Every night in America, around 50 million people climb out of bed to use the bathroom. Not once, two, three, sometimes 4 or 5 times. Here is what almost no doctor tells you in a 15-minute appointment. In roughly 80% of these cases, the bladder isn't the problem at all. The pills, the herbal blends, the supplements you've been buying for your prostate or your weak bladder, they are aimed at the wrong organ entirely. I'm Dr. Emily Chen. If that idea is new to you, tap subscribe and hit like. This channel runs on one idea. The healthcare system gets paid to keep you managing symptoms, not to actually get you well. What I'm about to share, no one in a waiting room is going to walk you through. Picture 3 in the morning. The house is silent. You finally sank into one of those deep, heavy sleeps. The good kind. Then, somewhere on the edge of awareness, the quiet pressure begins. You try to ignore it. The pressure grows. You peel the covers back, plant your feet on a cold floor, and shuffle to the bathroom on autopilot. You squint at the light, finish, and crawl back into bed. And sleep is gone. An hour passes. You finally drift off. Then it happens again. In the morning, you wake up wrecked, drinking coffee like medicine just to make it through the day. I see this in patient after patient, and almost everyone says the same sentence. Doctor, it's just my age. Everyone goes at night. That is not true. It is a comfortable explanation that is costing people years of their cardiovascular and cognitive health. Waking up to urinate is not normal at 40, not at 60, not at 75. At night, your brain releases a hormone called antidiuretic hormone, or vasopressin. Its job is to dial back filtration in the kidneys, concentrate the urine, and run the system in low-power mode while you sleep. That is what allows a person to sleep 7 or 8 hours straight. When that signal stops doing its job, it has a clinical name, nocturia, and it is a diagnosis in its own right. 1 trip a night is a warning. 2 or more is the smoke alarm going off. Every time you wake up, your pulse climbs, your blood pressure spikes, and you crash out of the deep sleep stage where your brain clears metabolic waste, your neurons repair, and your heart truly rests. Lose that phase year after year, and you have a direct on-ramp to hypertension, depression, and accelerated brain aging. Published research shows nocturia stresses the cardiovascular system more aggressively than cigarette smoking. Most patients have already made up their minds before they walk in. The men say, "It's my prostate." The women say, "It's menopause," or "It must be a bladder infection." So they buy the urological supplements, choke down diuretic teas, and stop drinking water after 6 in the evening. They go to bed with their mouths dry, and they still get up at 3 in the morning. Why? Because they are treating the noise of the alarm, not the spark that set it off. A smoke detector starts shrieking at midnight. Almost no one would climb a ladder and yank the battery to shut it up. They would find the fire. Your bladder is the sensor. In 4 out of 5 cases, it is perfectly healthy, just emptying whatever someone keeps pouring into it overnight. The real question is who is doing the pouring at 2 a.m. and why? The answer will surprise you. The culprit sits in your legs and your heart. Before I take you any further, 2 warnings. After 15 years in practice, I have seen what happens when a patient ignores certain signs to keep scrolling for natural fixes. The first red flag is painless blood in your urine. Note the word painless. If it hurts and there's blood, you are most likely dealing with a kidney stone or a urinary tract infection. Miserable, but treatable. If the urine looks rust-colored, dark red, or contains visible clots and nothing aches at all, that is one of the earliest warning signs of bladder cancer, particularly in anyone over 50. That finding needs a cystoscopy, a urologist placing a small camera into the bladder. Do not wait it out. The second is bone or pelvic pain combined with unexplained weight loss, 10 or 20 pounds in 2 months without dieting. That pattern can signal advanced disease and needs a workup, not a video. If neither applies to you, breathe out. You are going to be fine. But your quality of life is worth protecting, and to protect it, we have to identify which of 3 different nighttime patterns you actually have. The 3 types of nighttime urinary trouble. Nighttime urinary problems split into 3 different categories, and what helps one will actively worsen another. Type 1 is global polyuria, too much urine, all the time. Frequent full-volume trips day and night, 3 or 4 liters over 24 hours, usually from drinking too much out of habit or from undiagnosed diabetes pulling water out with the glucose. The urine is pale and almost odorless. This pattern needs an endocrinologist and a blood sugar test. Type 2 is nocturnal polyuria, what 60 to 70% of people over 50 actually have. During the day, life is normal. You visit the restroom every 4 or 5 hours, nothing hurts, nothing burns. The moment you lie down, the system inverts. 3 or 4 trips, every one a real full void. In the morning, you stand there confused. You barely drank anything, so where did 1.5 liters of urine come from? Your kidneys idle during the day and sprint at night. The bladder is innocent. Type 3 is a reservoir problem. The urges are sudden, urgent, constant. You sprint to the bathroom, sit down, and almost nothing comes out. The trigger is firing at 50 milliliters when it should hold to 200 or 300. Causes include benign prostatic enlargement, overactive bladder, chronic infection, or bladder stones. So, frequent and large day and night, global polyuria. Fine in the day, flooded at night, nocturnal polyuria. Constant urgency with tiny output, a reservoir problem. Hold on to your category. We are about to look at the most common one. Arthur. I want to tell you about a patient. I'll call him Arthur. 54, no nonsense, only walks into a doctor's office when he is out of options. He sat down with a thick folder, bladder ultrasound, PSA results, 3 supplement prescriptions, and a look of complete exhaustion. Doc, he said, it's my prostate. Or worse, just tell me. For 6 months, he had been getting up 4 or 5 times a night. He had done everything the internet told him. Prostate capsules, no water after 6. He still woke up at 2 in the morning and released 0.5 liter of urine he could not explain. His PSA was normal. His ultrasound showed mild, age-appropriate prostate enlargement, nowhere near enough to cause his symptoms. His bladder was clean. From a urology standpoint, the man was essentially healthy, so I stopped asking about urination and started asking about life. Any breathlessness on stairs? A little. 2 flights up, I have to stop. Did his socks leave a mark on his ankles by evening? Yes, there's an actual groove. That was the moment the picture came together. Arthur, throw out the prostate pills. You don't need me. I'm sending you to a cardiologist and a sleep specialist. He stared. My heart? I'm running to the bathroom. I'm not having chest pain. But he went. The cardiologist found early-stage heart failure, quiet, no dramatic symptoms, but enough that his heart could not fully clear his blood volume during the day, so fluid was settling into the tissue of his legs. The sleep specialist found obstructive sleep apnea, brief, repeated pauses in breathing that scramble vasopressin and push the kidneys into overdrive. Arthur had been treating a leaking faucet upstairs while a pipe was bursting in the basement. What is actually happening inside your legs? Picture a plastic water bottle on its side. The water spreads evenly along its length. Stand it upright and the water falls to the bottom. Your body does the same trick every day. You spend roughly 16 hours upright, and gravity pulls blood, lymph, and tissue fluid downward toward your ankles and calves. In youth, the system fights back. Vein walls are elastic. One-way valves inside your veins snap shut to keep blood from sliding backward. The muscles of the calf, working with every step, squeeze blood upward like a second heart. With age, or with a sedentary day, that pump goes quiet. Vein walls slacken, valves leak, and fluid seeps out of the vessels into the soft tissue around them. As much as 1.5 liters of water can park itself silently in the calves and ankles. You barely notice. There is a slight imprint where the sock sat, nothing more. Your kidneys cannot filter that water. They only see what is circulating in your bloodstream. So, during the day, the kidneys produce a normal amount of urine while this hidden reservoir keeps building below your knees. Then, evening arrives. Arthur eats a salty dinner, a slice of pizza, deli meat, crackers, and cheese in front of the TV. From 7 to 11, he sits. Gravity keeps drawing fluid into his calves. His heart is loafing along at a low resting pace. Then he lies down. At that moment, everything changes. The heart's overnight SOS. When his legs come level with his heart, gravity is no longer the boss. The reservoir that built up in his legs slides back into the bloodstream. Inside 1 hour, the volume of circulating blood rises sharply, biologically, as if someone hooked him to an IV and ran an extra liter of saline into his veins overnight. His heart senses the load. The right atrium stretches as it fills. A small but mighty hormone, atrial natriuretic peptide, or ANP, gets released into the bloodstream. Think of it as the heart sending out a flare. Too much volume coming in, dump fluid now. That flare reaches the kidneys, switches off aldosterone, the water-retaining hormone, and tells them to filter at high speed. The kidneys obey. Within an hour, the bladder is full. Arthur gets up, empties 400 milliliters, goes back to bed. 2 hours later, the reservoir is still draining. Full bladder again. The cycle repeats until dawn. That is why a man who had not sipped water since 6 o'clock could fill the toilet bowl twice between midnight and morning. His legs had stockpiled 1.5 liters of fluid through the day, and at night his kidneys were processing all of it. No prostate supplement could touch that because the supplement was aimed at the wrong organ. 2 tests you can do. Tonight. So how do you tell whether this is happening to you? You do not need an MRI. You need your own thumb and a measuring cup. Test 1. The shin test. Sit down, roll up your pant leg, and find your shin bone, the hard ridge running down the front of your lower leg. About 4 to 6 inches above your ankle, press the pad of your thumb into the bone firmly for 15 seconds. Lift it off and look. If the skin springs right back, you are not holding fluid in that tissue. If your thumb left a soft dent that takes several seconds to fill in, you have located a hidden water store. The leg does not have to look swollen for it to be loaded. The dent is the proof. Test 2. A 1-day urine diary. On a quiet day, measure every void into a marked container. Track daytime separately from nighttime and include the first morning void in the nighttime total. Add them up. If more than 1/3 of your daily output happened at night, you meet the criteria for nocturnal polyuria. For example, 1,500 milliliters over 24 hours with 500 or more at night fits that pattern. If your shin dents and your night output is more than 1/3 of the total, breathe out. Your bladder is almost certainly fine. You do not need surgery. You do not need lifelong medication. You need to fix your circulation and reset your daily timing. 3 foods that will wake you up tonight. Food matters more than people realize. Several common evening choices act like a delayed timer on your kidneys, and most patients eat them while sincerely believing they are being virtuous. The first is hidden sodium. About 80% of the salt most Americans consume does not come from the shaker. It is baked into processed food, cheese, deli turkey, hot dogs, mayonnaise, canned soup, bread, even plain crackers. 100 grams of hard cheese carries as much sodium as a bag of chips. You just don't taste it under the fat. When that sodium hits your bloodstream at 7 in the evening, your body locks down water to dilute it. You don't run to the bathroom right away. But around 2 in the morning, your kidneys begin flushing that sodium out, and every gram drags water out with it. You are not waking up because you drank too much. You are waking up to eliminate dinner. The second is sugar after dark. A small bowl of fruit, a couple of cookies with tea. It's natural, patients tell me. Here is what is actually happening. Simple carbs at night spike your blood sugar. Insulin rises, and insulin tells the kidneys to hold sodium and water. 2 or 3 hours later, usually as you have drifted off, blood sugar drops and the kidneys swing the other way into rapid excretion. If you have any insulin resistance, and many adults over 40 quietly do, the sugar itself acts as a diuretic. You ate grapes, your body responded as if you took a water pill. The third is alcohol. The nightcap is one of the most common myths I deal with. Doc, a glass of wine knocks me out. I sleep right through. The truth is uglier. Alcohol shortens the time it takes you to fall asleep, but it is also one of the most powerful blockers of the overnight vasopressin signal. Your brain forgets to send the concentrate the urine instruction, and your kidneys run full throttle all night. You sleep through the first urge, the bladder keeps filling, and by the time the second urge breaks through, it is painful, and your sleep architecture is shredded. You wake up worse than you would have without the drink. 3 foods that will calm your bladder. Now, the foods that protect your bladder. First, raw pumpkin seeds, not the roasted or salted ones. Raw green pumpkin seeds carry zinc and magnesium in a form your body absorbs efficiently. Magnesium relaxes smooth muscle, including the muscular wall of the bladder, the detrusor, meaning the bladder can stretch to a larger volume before triggering the urge to void. The seeds also contain phytosterols, plant compounds that support pelvic floor and prostate tissue. About 30 grams a day is the cheapest, least glamorous bladder habit you can build. Second, cranberry. Not the bottled cocktail, which has more sugar than soda. The actual berry, fresh or frozen, or a standardized extract from a pharmacy. Cranberries carry proanthocyanidins, compounds that keep bacteria from sticking to the bladder lining. Many adults over 40 harbor a low-grade chronic irritation they don't know about. 50 milliliters of urine arrive and the bladder is already screaming. Cranberry calms that lining. Third, dietary fiber, purely mechanical. A constipated colon is a bloated colon, and the colon sits right next to your bladder. When it is overloaded, it presses on the bladder from outside, and a half-empty bladder starts signaling fullness. Vegetables, leafy greens, beans, oats keep the colon emptying on schedule. A calm colon at bedtime gives your bladder the room it needs to fill normally through the night. So, the evening plan. Cut the hidden salt. No cheese, no deli, no crackers after 6. Cut the late sugar. No fruit, no cookies, no sweet drinks. Skip the nightcap. Add a handful of pumpkin seeds during the day and a small portion of unsweetened cranberry. Arthur made just those food changes. He swapped his evening cheese and cured meat plate for a chicken and vegetable salad and dropped the cookies. From food alone, he went from 5 nightly trips to 4. Real progress, but not enough, because food fixes the chemistry, but if your venous valves are tired and your heart is straining, the physics of fluid keeps winning. So we added the second layer. This is the part I follow myself every evening. 3 steps: morning, daytime, night, about 5 minutes a day. Morning, prime the pump. Before you head for the coffee, stand up, feet shoulder-width apart. Rise gently onto the balls of your feet, an inch off the floor, and let your heels drop back down with a small, firm thud. Repeat 30 times, about once per second. You should feel a soft vibration moving up your calves into your thighs. That small repeated jolt nudges the one-way valves inside your veins back into action and primes the calf muscle pump for the day. If standing is hard on your knees, do the same on your back in bed. Arms and legs raised, shaking them lightly for 60 seconds. It looks silly. It works. Daytime. Shift your water curve. Most people drink in a curve that peaks at night. Flip that curve, aim to get 70% of your daily fluid in before 4 in the afternoon. A glass of water on waking, a bottle at your desk, tea and soup at lunch. After 4, sip only as needed. Don't let yourself get dry. Thirst thickens the blood and raises clotting risk, but the bulk of the day's water should already be in you. One small structural change with big returns. Take the salt shaker off the table. Cook with salt in the pot, season once, and let that be it. That single act cuts daily sodium intake by roughly a quarter. Evening. Reverse the pooling. This is the move that turns the whole pattern around. About 90 minutes before bed, while you are winding down, lie back and put your heels up, higher than your heart. Use the arm of the sofa, the seat of a chair, or rest them flat against the wall. About 45 degrees is plenty. Stay there for 15 to 20 minutes. Read, listen to something, scroll your phone. What is happening underneath? Gravity is now working with you. The fluid that has been pooling in your calves all day flows back toward the center of your body. The heart senses the load early, fires off A&P early, and your kidneys filter early. 30 to 40 minutes after you stand up, you will feel a clear urge to go and empty 300 to 400 milliliters, the exact volume that would have woken you at 3 in the morning. You are giving the kidneys their night shift while the sun is still up. If your legs visibly swell during the day, add knee-high graduated compression stockings. Put them on when you get home from work and wear them until your evening shower. Do not sleep in them. Bedtime. Strengthen the valve. Once you are in bed, lights out, do 20 to 30 Kegel contractions, done correctly. Most people do these wrong. They clamp the buttocks, the abdomen, and the thighs. None of that is the pelvic floor. The correct cue, imagine gently holding back gas or lifting the floor between your legs the way an elevator rises one story. Belly soft, buttocks relaxed, only the inside muscles move. Squeeze, hold 3 seconds, release slowly. 20 to 30 reps. Over weeks, this dials down the overreactive nerve signaling that makes a half-empty bladder feel full. Arthur. 1 month later. Arthur was skeptical. He laughed at me. Legs up the wall, heel drops? Within a week, he came back and said, with something close to disbelief, "I woke up once last night. Once, not 5 times." A month later, he was sleeping straight through. His cardiologist noted the leg swelling had clearly improved and his heart was working under less strain. None of it was magic. It was physics, applied on his schedule instead of his bladder's. How old are you? The pattern I just walked through gets stronger with age. Vein elasticity drops, valve competence drops, cardiac reserve narrows. Over 50, nocturnal polyuria from leg fluid is about 3 times more common than under 40. Drop your age in the comments. I want to see who is watching because it shapes what I cover next. Your 5-step plan for tonight. 1. Do the shin test. Press your thumb into your shin for 15 seconds and look for the dent. 2. On your next day off, measure your urine output and see what percentage comes at night. 3. Take the salt shaker off the table tonight and skip the cheese, the deli meat, and the crackers at dinner. 4. 90 minutes before bed, put your legs up against the wall or over the back of the couch for 15 minutes. 5. In bed, do 20 to 30 correct Kegels, pelvic floor only. And if the shin dent stays put, if you are winded climbing a flight of stairs, if your socks groove your ankles by evening, do not start with a urologist. Start with a cardiologist and a vascular specialist. That is the right path. Your body is not broken. Your bladder is not your enemy. It is a warning light on the dashboard. Now you know how to address what is actually triggering it, instead of trying to disconnect the wire. I've spent 15 years watching what happens when people treat the alarm instead of the fire. The plan I just gave you costs nothing beyond a pair of compression stockings and a few minutes a day. Your doctor will not walk you through this at your next appointment. There is no 12-minute slot in modern medicine for fluid dynamics and pelvic floor neurology. That is what this channel is for. If this helped, subscribe and hit like. Every subscriber makes it easier for the next exhausted person at 3 in the morning to find this. Share it with a spouse, a sibling, or a friend over 60 who has been blaming their age. The system is built to manage symptoms forever. My job is to make you not need me. I'm Dr. Emily Chen. See you on the next video.